Namaste viewers, this is Dr. Pratibha K.S. Today I'll be presenting lecture talk on growth factors, nerve growth factor and erythropoietin. Okay, let us first go through nerve growth factor. Okay, it is sometimes called beta nerve growth factor. It is a neurotropic factor and neuropeptide primarily involved in the regulation of growth, maintenance, proliferation, and survival of certain target neurons. In fact, NGF is critical for the survival and maintenance of sympathetic and sensor neurons as they undergo apoptosis in its absence. Okay, the human growth factor precursor has 241 amino acids. Okay, removal of propeptide from the precursor yields one that is 13 kilodalton polypeptide having 120 amino acids. This polypeptide forms a homodimer of 26 kilodaltons, which is functional NGF. NGF binds to a low affinity receptor and to a high affinity receptor. The low affinity receptor does not mediate the neurotropic effects of the NGF family. The effect of the low affinity receptor induces neural cells apoptosis, which can be inhibited by either NGF or the antibody binding to NGF. The high affinity receptors mediate NGF neurotropic activity and are exclusively expressed on NGF responsive cells. The NGF receptors are expressed on sensory and sympathetic neurons. Non-neural cells derived from the neural crest, including melanocytes and unmasked cells, B lymphocytes, monocytes, and the PC12 cell lines. Binding of NGF to its receptor includes tyrosine phosphorylation of several cellular proteins. Now let us go through the clinical significance. NGF promotes myelin repair. Hence, NGF may be useful for the treatment of multiple sclerosis. NGF could also be involved in various psychiatric disorders such as dementia, depression, schizophrenia, autism, Rett syndrome, anorexia nervosa, and bulimia nervosa. This regulation of NGF signaling has also been linked to Alzheimer's disease. NGF has been shown to play a role in a number of cardiovascular diseases such as coronary arteriosclerosis, obesity, type 2 diabetes, and metabolic syndrome. NGF has also been shown to accelerate wound healing. Okay, this is all about clinical significance of nerve growth factor. Okay, further now let us go to erythropoietin, in short EPO, also known as EPO. Okay, hematopoietin or hemopoietin is a glycoprotein hormone that controls erythropoiesis or red blood cell production. It is a cytokine, that is protein signaling molecule for erythrocyte, that is red blood cells, precursor in the bone marrow. Human erythropoietin is of 36 kilodalton and it has 166 amino acids. Okay, the molecule is derived from a precursor of 193 amino acids. The EPO receptor belongs to the hematopoietin receptor family. EPO receptor couples directly to JAK2 kinase to cause tyrosine phosphorylation. Erythropoietin is produced by interstitial fibroblasts in the kidney in close association with peritubular capillary and proximal convoluted tubule. It is also produced in sinusoidal cells in the liver. While liver production predominates in the fetal and prenatal period, renal production is predominant during adulthood. Okay, now let us go through the functions of this erythropoietin. Red blood cell production and non-hematopoietic roles. Okay, red blood cell production. EPO is an essential hormone for red blood cell production. It has primarily effect on red blood cell progenitors and precursors by promoting their survival through protecting these cells from apoptosis. Non-hematopoietic roles includes vasoconstriction, dependent hypertension, stimulating angiogenesis, and promoting cell survival via activation of EPO receptors, resulting in anti-apoptotic effects on ischemic tissues. However, this proposal is controversial with numerous studies showing no effects. Okay, when coming to the mechanism of action, EPO has been shown to exert effects by binding to the erythropoietin receptors, in short EPOR, that is erythropoietin R, on the red cell progenitor surface and activates a JAK2 signaling cascade. Now let us go through medical uses. Okay, recombinant human erythropoietin, in short RHEPO, produced by RDT in cell culture. Okay, used in treating anemia resulting from chronic kidney disease, chemotherapy induced anemia in patients with cancer, okay, inflammatory bowel disease, and myelodysplasia from the treatment of cancer, chemotherapy, and radiation factors. However, increased hemoglobin level, that is more than 11 to 12 gram per dl, may cause stroke, okay, venous thromboembolism, then myocardial infarction, tumor recurrence, and risk of death also can be seen. Okay, this is all about erythropoietin. So, from the beginning, we went through nerve growth factor, NGF characteristics, then the clinical significance, okay, then we went to erythropoietin, then their functions, mechanism of action, then medical uses. Okay, so this is all about the growth factors. Okay, thank you for watching this video.